Hey mama, I want to talk about movements that are going to be good to start exercise again postpartum. This can be within the first 3 weeks postpartum, 6 months, a year, 3 years, 5 years, 40 years after you had your kids. You can do this anytime. Now, if it's in those early weeks after having your baby, that's going to be helpful for healing and for recovery. Now, it doesn't mean that it's going to be helpful when it's 40 years down the line, but that can be something like I'm almost 2 years postpartum. So I'm integrating these things into my warm-ups, into my cool downs, when I'm watching TV, when I'm reading to my little one in her room, I'm sitting in a 90-90 or in pigeon. These are going to be really good things for the body that can help with stability. They're going to help with mobility. And it's also a way to downregulate the nervous system. So we're going to go over a lot more depth of these types of exercises and intensities in my 8-week group coaching program, the Strong, Nourished, and Energized Mom Method. And enrollment for that opens in this August in 2025. But for now, I want to go over movements that are not as intense and may seem a little bit boring to some moms, okay? So I first want to start with a 90-90, and this is part of the BirthFit Basics. So I'm a certified BirthFit coach along with a pregnancy postpartum athleticism coach. And so in my program, I integrate the BirthFit Basics. So 90 degrees with the back leg, 90 degrees with the front leg. If that internal hip rotation with that back leg is irritating, my hips are pretty tight, my glutes are tight, it's kind of talking to you, I'm just going to bring it in a little bit and I can just hang out here. So this is actually something that your babies are going to be doing as they're learning to crawl and stand and walk. They're going to be sitting in this position all the time. It's actually pretty cute. So here you can start in this position. You can breathe. You can sit back. You can do some windshield wipers. So you're just getting in movement of the hips. Again, this can be a really, really good warm up. This can be a great cool down. If your low back or SI joint is talking to you, this is something that I typically do just to kind of down-regulate the nervous system, tell the brain, hey, it's safe, we're good, we can relax that nervous system. And then it's also really good for bed. So you can do some windshield wiper movements. If you have the mobility or after working with that, with hands back, you can sit up nice and tall. So head over shoulders, shoulders over hips, rib cage down and in, slight tuck in the tailbone, belly button to spine. Okay, so you're not sucking in and you're not 100% bracing the core, but you are engaging. You're sitting up nice and tall and you're breathing. We have to make sure that we're breathing. If you cannot breathe in a position, you do not own a position. So something that I have learned from my movement and mobility courses with Kelly Starrett, the Ready State, and we want to be able to breathe. And as a mom, especially after having your baby, that's important because the breath connects with the nervous system to the rest of the body. So can I sit up nice and tall and move through those windshield wipers, that 90-90, pretty much almost 90-90, and I'm kind of moving forward a bit. Okay, now from here, what I teach you in my program is how can we get up off the floor. So that's something I'm thinking also decades down the line. When I'm 60, 70, 80 years old, I want to be able to get up off the floor. And that's actually going to be a marker for longevity, for fitness, and for health. Because those who cannot get up off the floor, they're going to die a lot sooner than those who can get up off the floor. And we're talking about older individuals. So then if I'm doing tummy time with my baby, I want to be able to, or playing with my toddler, reading her a book, I want to be able to get up and stand up without hurting myself or having to use other things to stand up. So this is a really good movement for so many things. So once you get into that position, then we can play around with some 90-90 moving in here. There's no right or wrong, okay? I want you to just move around, breathe, what feels tight. When you feel something talking to you, when something is tight, like when this internal hip rotation, my hip is really talking to me, I'm going to hold it. I'm going to contract these muscles and then I'm going to release so I can get deeper into that stretch. So I'm going to contract, squeeze, 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 and then relax. So it's basically like holding my breath almost, not really, as I was talking to you. So going through that contract, relax, and then I can get deeper and I'm like, whoa, I can actually feel that is so much better. Contract, I can drive this knee into the ground, drive, relax. I can drive this foot into the ground. I got to get more into my 90. I can drive, relax. I can move forward. That feels a lot better than back. So I can play around there. Once I'm there, and you can do this while you're watching TV. That's what's so nice about this. Okay, I'm going to do the other side. We're just going to go over this movement today. I'll continue to keep sharing other videos. So 90-90, that internal hip rotation is typically where we're going to feel it for most people, not in this external hip rotation. And again, I'm just going to move, breathe through it. Where do I feel that tension? I don't really feel it up here, but I definitely feel it in this back leg and that internal hip rotation. So I'm going to contract. I'm going to try and contract the glutes and the legs. Contract, contract, contract. Relax. Maybe I move through it again. Maybe I drive that knee into the ground. Drive, 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 contract, and then relax. Move around. And this is going to be really great for lower body strength. So when you're adding in back squats and deadlifts and other movements in the gym, this is going to be really great for that. And along with activities of daily living. So again, something that you can start with, windshield wipers. You can do this literally anywhere, anytime. What's really nice, right? When you're have access to the ground. And then you can play around with that windshield wiper sitting up nice and tall. A lot of the times, depending on stiffness, it may take a lot of work, but the more you practice it, the easier it'll become. And then I want you to practice that 90-90, moving around, seeing what feels good, contracting, relaxing, driving the knee into the ground, driving the foot into the ground, relaxing, and seeing how that feels. Let me know what you think in the comments or email me. Let me know. I want to know, because these are going to be really, really great exercises for not only early postpartum, but years down the line for functionality and for our health, our well-being, and for us to be able to get stronger. So enjoy, and then be on the lookout for open enrollment for the Strong Nurse and Energized Mom Method group coaching program. Bye, guys.